Good afternoon. My name is Jess Brady, and I am here to talk to you about kinesiotape and its perceived effects. This is an EBP module that's worth 0.25 hours. We're going to cover two domains today. We're going to cover domain number 2 and domain number 4. Domain number 2 is the clinical evaluation and diagnosis. Domain number 4 is treatment, rehabilitation, and reconditioning. The level of difficulty of this module ranges from essential to advanced. It does contain some core theory, and it does also contain a little more advanced theory and application. What are our objectives? Our objectives today, you should be able to evaluate the efficacy of kinesiotape for acute injuries. You should be able to determine whether using kinesiotape application would be beneficial for your patients or your athlete. And you should be able to summarize the basic uses of kinesiotape for the treatment of athletic injury. So our clinical question: is there a perceived sense of healing or improvement when using kinesiotape compared with non-kinesiotape or no tape in athletes with acute injury? So what's our practice gap? I think our practice gap here is that there are those that use it and there are those that use it skillfully and thoughtfully. Maybe new graduates have had more exposure to it. They learned the basics of kinesiotape in a clinical setting or in a classroom setting, whereas maybe graduates that are, may have graduated 10 plus years ago may know the theory behind it maybe and can apply it, but are they applying it skillfully and thoughtfully so that there are positive response and positive outcomes? What is kinesiotape and what can it treat? Kinesiotape is a therapeutic taping technique used to treat a variety of orthopedic, neuromuscular, neurological, and other medical conditions. It's theorized to decrease pain and inflammation by improving lymphatic and blood circulation without restricting range of motion by going circumferentially around an injury or a limb. KT tape provides a pulling force to the skin that supposedly increases the distance between the fascia and soft tissue under the applied area, allowing for maybe easier channels for lymphatic return. So what are the advantages of kinesiotape? One of the biggest advantages of kinesiotape, in my opinion, as a secondary athletic trainer, is that it is an inexpensive intervention. It's also a time saver. It can be worn 3 to 4 days consecutively, meaning I'm not having someone come in every day for a reapplication. It was developed for moisture and airflow because it's latex-free and porous. Another reason why it lasts so long. I will have kids wear this 5 to 7 days, depending on the location and the activity level of the athlete. It can also be stretched to 120 to 140% of its original length, and then it can also return back to its original length. And again, what we're looking at today, there is definitely a possible placebo effect to this tape application. What are its uses? There are a lot of uses, but the main ones are acute, subacute, and chronic injury. We can use it for muscle imbalances. We can use it for circulatory and lymphatic issues. We can use it for ligament, tendon, and joint injuries, fascial adhesions and scarring, and also pathological movement patterns like scapular dyskinesis or even just posture control in sort of a biofeedback sort of way. So here are the basics. There are 4 basic strips that we use to apply KT tape. As you start using this and as you start learning more things, you find that you can cut this tape into 1 billion different possible ways. But these are the 4 that we use, that I use most regularly. The first being the basic eye strip. Okay, and you can tell the difference between mine and theirs is that I round my corners off to reduce the amount of rolling. This strip, the tension is focused within the therapeutic zone, so the therapeutic zone is the entire length of the tape, and it's spread over the target tissue. The second is the Y strip. The Y strip is exactly what it sounds like. It is shaped like a Y. So here we can see that Y strip. We cut down to almost the tail end of it. And again, I round my corners. The Y strip, the tension is dispersed through and between the 2 tails over the target tissue. The next is an X strip. So you cut the center down to almost the middle. and you create tails on either end. Again, I round these corners as well. The tension on the X cut is focused directly over the target tissue and dispersed through the tails. Last is the fan cut. I call this the octopus. Again, the ends are rounded. And this is the one that I use most often for circulatory or lymphatic issues. If you get an octopus or a fan that's really long, you can probably cut this into 6 as opposed to 4 fans. So for the fan cut, the tension is dispersed over the target tissue through the multiple fans, or the multiple tails, I'm sorry. So for the 2 things that I use this for, musculotendinous application and circulatory and lymphatic return. For musculotendinous applications, we use this in 2 ways. We use it to inhibit an overused muscle, and we use it to facilitate a weak muscle. So if we're using this to inhibit an overused muscle, this is going to be for an acute condition or something like a muscle spasm or a strain. We're going to take this strip, particularly usually an I strip or a Y strip. We are going to go from distal to proximal. We're going to put the tension on the tape about 15 to 25%. To be honest, if you play around with it and you pull the tension to 100 and then back it off to 50, back it off to 25, that's about where you want to be, maybe a little bit less. Conversely, if you want to facilitate a weak muscle for a chronic condition or rehab, this is especially useful for doing for facilitating the quad and ACL, post-ACL surgery. So what we're going to do, we're going to do the reverse. We're going to go proximal to distal, and we're going to maybe use a little bit more tension, up to 35%, but honestly, I usually, for both of these, go between 15 and 25%. In these 2 examples, we've got inhibition over the gastroc. So we see here that the direction of our tape is distal to proximal, which is in the same direction of pull as the muscle or the contraction of the muscle. So we are inhibiting it or allowing it to relax in a state of acute or painful injury. Over here we are facilitating a muscle, so we have a weak muscle or some sort of chronic injury where we want to help that muscle and want to help it to contract. So it's the opposite. We're going to go proximal to distal, and we're going against the direction of the muscle contraction. So we're helping getting that thing going. Again, this is really useful for something like an ACL post-surgery, trying to wake that quad up. The other use that I find use of K-tape that I find very helpful is the use in circulatory and lymphatic corrections. For this, we're going to use 0 to 20% tension. To be honest, I use no tension on this at all. This is simply to raise the skin away from the fascia and create some channels for some of that fluid to get away. Typically, we're going to anchor approximately towards the closest healthy lymph node. The direction of pull of the tape allows the exudate or the extra fluid to travel to less congested area through that superficial lymphatic pathway. We fan those tails applied over the congested area. So if this was a quad contusion, we're going to take and put those tails right over the quad contusion. That being said, this uses 2. You can just use 1 fan to make it simple, but honestly, all you do is you apply 2 tails and then crisscross them over each other to create that pattern. So here's a good example. So we have a bit of a hamstring tear. We start with those crisscross fans. Over here, this is about 1 week post-application, 2 weeks, and near the end of its healing. So we see that we've created these channels, and it allows this fluid to go to kind of less congested areas. Does it work? Yes and no. Callahan found that that the application of KT tape did decrease pain and soreness. Yasukawa also found that it improved lymphatic drainage and blood flow. However, on the other hand, Firth found that there's no improvement in strength and power or in pain relief. Similarly, Fu et al. Found that KT tape didn't enhance performance, and again, it didn't reduce pain. But what about perception? Better is better. It's a sign I have over my training room door. So what is perception? A study done by Hunt and Short, it found that perceptions ranged from these feelings of increased confidence, increased strength, decreased anxiety for injury or re-injury, mental preparedness prior to performance, part of pre-performance routines, and even part of superstitious practices. And we know that athletes are very superstitious. Also, perception or placebo can be defined as a symptomatic improvement from a treatment or intervention that does not result from the substance or intervention itself, but due to the expectations involved with the treatment. So what do we know about perception in the research with KT tape? So all the research that I found used a visual analog scale. Remember, this is perception, so this is subjective. So they all used a visual analog scale of 0 to 10. I think they all used the same visual analog scale, which was the 100 millimeter visual analog scale. It's pretty standard. We found, Lee et al. Found that subjects that had been kinesiotaped versus those that had not been taped reported feeling less fatigued after testing anaerobic power, muscular strength, and endurance. Similarly, a study done by Mack et al., participants reported improved self-perceived performance with kinesiotape versus no tape. And in the discussion, they directly related this to the placebo effect. So it's something that researchers are aware of and are actively pursuing. Last year, a randomized double-blind crossover study that was done by Cho and his colleagues noted significant between-tape differences in pain, indicating that kinesiotape was better at controlling pain than a sham tape or a placebo tape. So we can see here in this first, we're looking at pain with 1 kilogram of resisted extension. We see that with KT tape, we go down almost 2 points in that visual analog scale with the application of KT tape versus a sham tape. So what's our clinical bottom line? What does this all mean? Well, we know that kinesiotape is an inexpensive and widely used intervention. I think over the past 10 years, this has become more and more and more popular. Since its first appearance, I think, in the Olympics in, I think, 88, we have seen more and more elite athletes and far more lower-level athletes, semi-pro, college, and high school-level athletes starting to use this. It can be used to treat a wide variety of issues. Like I said, I've used it for musculotendinous injury. I've used it for circulatory and lymphatic issues. I've seen people use it for migraine relief, biofeedback, posture control. It can be used for a lot of different things. However, its efficacy is uncertain. There are mixed results in the research. Some say, yeah, it does exactly what it says it does. It reduces pain, increases performance. However, there's a lot of random control trials that show that it's not, that it doesn't do what it says it does. However, perception and placebo can play a positive role in the athlete's treatment, and the current literature seems to indicate that there's a positive perceived benefits to these kinesiotape applications. And while perception and placebo effect are widely researched in regards to other things, perception as it applies to kinesiotape is not as thoroughly researched, and there is a lot of room for more research in that area. Here are my references. Thank you very much for listening. If you have any questions, please don't hesitate to contact me.